Okay, welcome back. This is Dr. Jin Sung, and this is part 2 of autoimmune disease. Now, autoimmune disease can be pretty complex and pretty difficult to understand. What I'm trying to do for you is to break it down so it's simple to understand and simple to implement in terms of changing your lifestyle and looking at the different triggers that may create autoimmune disease or trigger autoimmune disease. So last week we spoke about your Th1 and Th2 systems, basically your immune system trying to be in balance. And there's a Th3 system in the middle that is like the referee between the two systems, and how the shifts in your immune system can create an autoimmune process. Okay? So the 3 nutrients we talked about last week were glutathione, essential fatty acids, and vitamin D as 3 nutrients that can be helpful in modulating your Th3 system, which is your referee for your immune system. Okay? This week, we'd like to talk about autoimmune disease and the different priorities in terms of healing autoimmune disease. Just to talk about some of the causes before we get into some of the priorities in terms of treatment. Certainly genetics will play a part in autoimmune disease. So will immune system dysregulation, hormonal shifts, especially stress. Stress would be a huge factor in terms of triggering autoimmune disease because of the constant impact of cortisol and the inflammatory processes that can occur as a result. Environmental triggers, certainly mold, toxins, heavy metals, etc., even electromagnetic fields can create an autoimmune trigger. Infection is a big trigger in autoimmune disease. It can create what we call molecular mimicry, and it can create some issues in terms of autoimmune disease. Vaccines. Vaccines in itself may not be the problem, but some of the components of vaccines that are utilized for preservatives and adjuvants can create problems for some people with autoimmune predisposition or genetic predisposition. So it's important to look at those types of things before vaccinating your children, etc. So that needs to be spoken to in terms of what is right for the patient, and not just a global vaccination, but maybe scheduling it out a little bit differently for patients. But certainly vaccines can be a very important part of autoimmune disease. So if you look at some of the more common autoimmune diseases, such as systemic lupus, Epstein-Barr viruses can be a trigger for that. Okay, so if you have had Epstein-Barr and you develop lupus, you might have chronic activation of your Epstein-Barr viruses. Okay, the other one is something called PANS or PANDAS. Is basically pediatric autoimmune neuropsychiatric disorders associated with strep. So it's called PANS. So what happens is sometimes when children develop strep infections in their throat, the strep infection can migrate and can create molecular mimicry in the basal ganglion or some other parts of the brain, which can create PANS or PANDAS. And it can create movement disorders, anxiety, stress, mania. It can create a whole host of different things because it affects nervous tissue. So that's another type of autoimmune process that can occur. Another one is scleroderma. Sometimes silicone implants, breast implants, can create a trigger for that. In terms of MS, Epstein-Barr, or something called HHV6, which is a form of Epstein-Barr, but that specifically affects the brain and can create some triggers for MS. Campylobacter jejuni, which is an organism in the GI tract, can also create problems for an autoimmune process called Guillain-Barré syndrome. Okay, so when we look at autoimmune disease, we look to see if there are certain triggers that can create that process. for women, just being a female is a predisposition for autoimmune disease. Women who go into menstruation when they have huge hormonal shifts, where you have the menstruation portion, right? Then it can create things like Hashimoto's thyroiditis. It can create a hormonal shift which shifts your body into more of a immune dysregulation and create problems, especially with thyroid. Sometimes during pregnancy or just after pregnancy, when you have this hormonal shift from carrying the baby to not carrying the baby, it can also create an autoimmune process, especially with thyroid. Another one is when you go into menopause. If your adrenals or adrenal glands, your stress hormones that are produced from the adrenal glands are not in order, sometimes when you go into menopause, it can create an autoimmune disease. Okay? So, when we look at different priorities, what do we need to look at? Okay? First, the autoimmune disease itself. What triggers are there? What do we need to do to address the, let's say, the bacterial infection or the viral load, right? Or the heavy metals or the bacteria in your gut. All those things matter in terms of how your autoimmune disease is going to be handled. So it's important to find the triggers for the autoimmune disease and remove the triggers. Okay, that's number one. Number two, you have to be able to manage your blood sugar. Meaning, we do not want to have diabetes, we do not want to have hypoglycemia. These ups and downs of blood sugar create cortisol problems, insulin problems, which can all be inflammatory to a certain extent. So blood sugar problems are very important in terms of managing stress hormones, right? So therefore, management of blood sugar is important for hormone regulation. The other thing is anemias. There are different varieties of anemia. One of the more common ones is iron deficiency anemia, but there's also a B12 or folate anemia is also. So B vitamin metabolism is also very important for that. So you have to look at anemias. You have to be able to carry oxygen, right? If your body does not have the ability to carry oxygen to all the tissues, especially the brain, then you are susceptible, right? It is a weakened structure if it's not getting enough blood flow. So blood flow is hugely critical in terms of overall health, right? So if I have a female, let's say, who's going through menopause, right, and they have anemia on top of that, and then they have some blood sugar problems, right, and they get bloated all the time after meals, they are setting themselves for an autoimmune disease. Okay, so anemias need to be addressed. Digestive disorders, right? Make sure all the infections and make sure your gut ecology or gut microbiome is intact and healthy, so that your immune system in your GI tract can be intact and healthy. So it's very important for the gut function to be intact. Okay. Another thing is essential fatty acids. Oftentimes, we're not getting enough essential fatty acids, and we are skewed in terms of what kind of fats we take in. Oftentimes, it's the refined vegetable oils, which are not very good for us. We need to take in more fish oils, right? Coconut oil, avocado or avocado oil. All those things can be very essential in terms of brain function, nerve function, or anti-inflammatory function, right? So your essential fatty acid needs to be in order. One of the big impacts is stress management. If you're under stress, so let's say you're in a relationship that is very bad, right? Let's say you are the husband and you are driving up to your house and your heart starts to race, starts to palpitate for the expectation that you may get into a fight with your spouse. That is a huge impact on physiology, right? If you are in a very bad relationship, if you are in a very bad work environment, this can make a huge impact in terms of autoimmune triggers, right? So stress management is crucial because stress itself will affect digestion, right? It will affect sleep, and sleep, if you don't sleep very well, then you can't heal very well. So all those things matter, right? So stress management is a huge part of this. Another thing is liver, in terms of detoxification. If you have toxins in your body, you need to be able to detox your systems. Now, if you go back a few weeks, I did speak about liver detoxification, about phase 1, phase 2, phase 3. I'd like you to go back and watch that video on liver detoxification, because liver detox also plays a huge part because it helps to prevent the burden of heavy metals, the burden of toxins, etc. And you have to be able to function within the liver to dump out things into the small intestine, etc. So it's very important. So looking at different priorities, look at the autoimmune triggers, blood sugar management, anemias, whether it's iron deficiency or maybe a megaloblastic anemia, or maybe you have an autoimmune disease where you have intrinsic factor antibodies that can create malabsorption in the gut. So anemias are very important. Digestive function along with liver function is very important for autoimmune disease. Essential fatty acids is very important. And a big factor is also stress management, because stress will impact your entire physiology. You have to be able to live in an environment that promotes healing, not this constant, go, go, go attitude, or constant stress because of a partner or a work environment, or some people who work night shifts. You work 3 days on during night shifts, and then you have the other 4 days, but 2 of the days you're kind of recovering from the night shift. And then once your body gets acclimated to it, you go back to a night shift. These huge shifts in your cortisol will also impact autoimmunity. So what I'd like you to do is really look at all your priorities, right? Did we find your autoimmune triggers? Is my blood sugar managed? Do I have anemia? Do I have digestive problems? Do I have liver issues in terms of detoxification? Am I taking in enough fatty acids or essential fatty acids? And is my stress managed? Those are all your priorities. You have to look at it and then analyze it and then say, how do we remove those triggers and how do we start to heal? So in our office, what we do is we do extensive testing. We need to figure those things out. And also, we help the patient to discover what their stress patterns are, right? Sometimes they just don't understand that working 70 hours a week, having 3 kids, eating in the car, sleeping 4 hours a day can be a huge burden on the body. And people don't realize that. So it's very important to accept or realize what's going on in your life so the healing can begin. Okay? So I'd like to thank everyone who watched last week. Please like and share the video. And please go back and look at some of the other videos that talk about blood sugar, the liver dysfunction, gallbladder, stress management, sleep. We have some of those videos already in prior weeks, okay? So we'll see you back next week. Have a great week, and next Tuesday at 12:30, all right?